again. And welcome. I was just telling Director April Calvin just now, I remember what I was doing on 9/11 23 years ago. So I was, and this is a full circle moment for this historical moment of lived experience, right? So I was in Metro Action Commission's GED room. It was Dr. Collins' room. And so my little baby, he was 3 months old at the time, he was screaming and yelling. I'm like, oh, I forgot I had the baby here because I left him in his snowsuit. And we had paused because we saw the news of what happened. And so it was like I just completely forgot that I had a little person with me. So I remember the day, and just, again, full circle to sitting in this seat. It's like, wow, from that moment. So, and welcome, Derek, from Metro Legal. We're gonna, wow. Just pause on that for a second, just remembering the day and what took place and what we're here to do in the houseless community, to move it forward to be able to end homelessness is what all of us are sitting in this room about. So welcome, everybody. It's so good to see your faces and everyone that's sitting around this semicircle with me, and just welcome to everybody. I want to give a shout out also to my vice chair because his position is historical as well. I've never seen a male sit in the vice chair or, any chair position. So I feel like his position is historical too, Mr. Rico X, which is one of our homeless planning council members as well. He's not able to make it today. We are sending good vibes to him and hoping all is well. But just wanted to acknowledge that today. And also myself, sometimes we don't celebrate ourselves. So that's something for me. I have to force myself to celebrate myself. So, yeah. Thank you, everyone. And thank you so much to each one of my fellow Homeless Planning Council members that made this possible. To all our new Homeless Planning Council members, welcome. And also our new executive committee as well. I'm gonna go ahead and, let's see, get the roll call. So some people were not able to make it already. I guess I'll still call the roll as normal and just let you know who wasn't able to make it, if that makes sense. So first name is going to be myself. I'm present, no conflict. Stephen Handy.
Present, conflict.
Okay. And he has a conflict. And welcome to the executive committee as well. He accepted his seat. So Deidre Nicole. And Liz Mallard.
Present, no conflict.
Welcome to the executive committee as well. She accepted her seat. And thank you for being here today. And Alex Smith. Jamie Villegas.
Present, no conflict.
Okay. Good morning. Dr. Exadria. How do you say it? Am I saying her name? Exadria. And she already let us know she was not able to make it. India.
Present, no conflict.
And let's say right there, Drew Freeman.
Present, no conflict.
Welcome and good morning to both of you all. Diana let us know she was not going to be able to make it. Michelle Southard.
Present, no conflict.
Good morning and welcome to the HPC. Andrea Hancock let us know she was not able to make it already. Meredith McLeod Julian. Jolene, apology.
I'm here, present, no conflict.
Welcome to the HPC as well. David Lango Martin.
Present, conflict.
Okay. Good morning and welcome. Jordan Huffman. Oh, okay. Okay, Jordan Huffman let us know, he was not able to make it as well. Councilwoman Courtney Johnston,
Present, no conflict.
good morning and welcome to the executive committee as well.
Thank you.
And no conflict is there. Okay, John Rutherford. No, okay. Oh, yeah, he let us know he was not gonna be here, I apologize. Rico X let us know he was not gonna be here as well. And he's executive committee, obviously as well. Adam Hassan,
Present, no conflict.
good morning and welcome. All right, Ashley Horton. No, okay. As blessings on Ashley Horton, we have a note about her in our packet and just prayers for her from the Homeless Planning Council. Lizzie Goddard. Good morning and welcome. Jaha Martin,
Present, no conflict.
welcome. We're glad to have you. And Laura Ward. Okay, no, she let us know she wasn't gonna be here. And our non-voting advisors, April Calvin. Good morning. And then we have Treva Gillian and Susie Tomey with MDHA as well on the roster. And I saw Miss Susie somewhere back there. Good morning and welcome. And so we'll go to, the memo from, Office of Homeless Services. Okay. So give me a minute, y'all. I'm working through this. Like everybody's giving me, thank you. So remembrance and moment of silence. Yeah, we have a long list of people that we lost, which in my papers, I believe I buried it. Just a second, give me a moment. Here they are. Okay, so these are the names of the people that we lost out without shelter. So we're gonna read their names, acknowledge them, and just prayers and thoughts for their families. And we're gonna take a moment of silence after we've acknowledged them. So we have Craig Hunley, Charlie Walpole, Robert, we don't have a last name for him, Shalice Offutt, Keith Mason, Christopher Walter, Jeffrey Kimbrough, Herbert Lane, Lucy Duke, Robert Talley, Shad Orr, Thaddeus Vahans, I think it's saying Vavans, Joseph Christophora, Eugene, Eiley, I believe, Lolinda Burns, Melissa Lay, Lauren Lunsford, Darren Slater, Brandon Calloway, John Pearson, Scott Thomas Sasma, Johnny Norris. And if we could take a moment of silence for those lives. Okay. And if we could also, in your package, you have August, the 2024 minutes review. If we could look over those, and if you have any corrections that you may note, we'll take a moment to go over that and just let us know if you have anything that needs correction throughout that. If there are no corrections, then we'll move to the next item on the agenda, which is going to be the Unified Housing Strategy presentation and discussion. The floor is open for any corrections. If there are none, we're going to welcome up the Planning Department. And if you could introduce yourself, and we're going to go into our Unified Housing Strategy presentation and discussion. I want to note that this is, kind of a free-flowing conversation, just giving our thoughts on what's going on with the current state of homelessness and housing across the board. If it's any, I'd say good things happening, challenges, or what your vision is towards especially ending homelessness is huge. So just keep in mind, this is from 8:40 till 9:25, and we'll just go from there and kind of flow.
Okay, thank you.
Welcome.
Good morning, Council. My name is Casey Ensign. I'm a senior policy analyst with Metro Nashville's Housing Division. I'm joined here today with our partners from Pillars who are going to be helping lead a conversation with you all. I'll have just a couple of remarks about our division, our work in the Unified Housing Strategy, but we really wanted to use this opportunity to gather some feedback from the members of the council to help inform the strategy that our team has been working to develop in partnership with a couple organizations, including Pillars. Awesome. No worries. All right, next slide. Great. So just a little bit about our housing division. We started a little over 2 years ago in January of 2022. We are housed in the planning department. There was always one or two folks working in the mayor's office focused on affordable housing, but there was no real office, dedicated division outside of the mayor's office focused on affordable housing. And so that is what our team does. We started as a team of 3. We're now a team of 10. We have been growing substantially over the last few years, and our vision is that every Nashvilleian has housing security. Next slide. So just a little bit about what we do. We administer the Barnes Fund, which is our local housing trust fund that provides grants to nonprofit and mission-driven developers who are building and preserving affordable housing across the city. We also administer a couple of other locally funded tools and programs, including the Mixed Income Pilot, the Catalyst Fund, some other programming that has been funded with ARPA dollars. We're also responsible for managing our affordable housing data inventory and coordinating across the city to help advance affordable housing as well. Next slide. So there's lots of different definitions of what is affordable housing, and I'll just really hone in on how our team defines affordable housing. We consider affordable housing to be for households who are earning 80% of the area median income or below. I'm not going to go over all those numbers today just because of time, but they are in your slide deck that you can reference. We choose to look at households earning 80% of the area median income or below because that aligns with federal definitions of HUD. It's very important for us to be in alignment with our federal partners, given that many of our developer community have to rely on multiple funding sources to be able to make an affordable housing project work. We typically consider housing that's affordable if it's priced at such a point that a person's not having to spend more than 30% of their gross income on housing costs each month. So if you're earning $100 a month, you should not be spending more than around $33 a month towards your housing costs. Next slide. It'll pass through this, Raquel. Next slide. And this just shows you the AMI numbers for Nashville. So just pointing out really quickly, a one-person household earning 80% of the area median income is someone earning just a little under $60,000. I always like to say that's as high as typically we will go in terms of funding housing, but that doesn't mean that we can't prioritize households who are earning 30% of the area median income or below, 60% of the area median income below. That's just pretty much as high as we will go in terms of funding housing properties here in Nashville. Next slide. Next slide. I'm going to skip through some of these. So a little bit about the Unified Housing Strategy, which is why our team is here today. We have had other reports, including the Affordable Housing Task Force report, which was published in 2021, that sort of served as our starting guide for our team with an initial list of recommendations. But we don't necessarily have a comprehensive plan for the city that looks across all of our resources, all of our partners. How can we better work together to advance housing security? And also looking at our programs that we have, what's working well, what's not working well. The Barnes Fund has been around for almost 10 years now, looking at that program critically and our other programs of how we can make sure that our dollars are being used most effectively for Nashvillians here. And so that's really what this strategy will be doing. It will include multiple components and analysis of our housing market, analysis of our housing data, analysis of our programs. We've also been doing substantial engagement with community members over the summer. We've held multiple community listening sessions. Thank you to Kanitha for attending many of those, and engaging with housing experts, including yourselves today, and also looking to what other cities have done, what are best practices that we could bring here to our community. Next slide. So our team is growing, but we couldn't do this work alone and really felt it was critical to have a third-party partner that could really provide us some unbiased recommendations on what is working well, what needs to be improved. And so we're working with HRNA Advisors, a consultant company that's based out of DC and New York that has substantial experience providing similar strategies for cities and states across the country, including Chattanooga. So we've partnered with them to do this work, and they also have a couple of other partners, including Pillars, MEPR Agency, and Spencer Rose, that have been helping lead some of the community engagement efforts. All right, and I'm gonna pass it over to Ed. Again, thank you all for letting us use part of the agenda today, and we look forward to getting your feedback.
Good morning, Commission. First, I'll take the opportunity to thank you all for your service. I sit on several boards and commissions, and so I know that it is a labor of love, and so appreciate that. I'm going to start off by giving just an overview of the process and the timeline. Again, this is meant for discussion, so if there are any questions, please let us know. I do have a fellow member of Pillars team with me, Melina Springer, so she'll be taking notes. So if I'm asking you questions, I'm listening attentively, I promise you. So if you don't see me write anything down, we are capturing your feedback. We also know that this is a public meeting and being recorded, so we'll also review that as well. If you go to the next slide. So first, to kick us off, there is a timeline associated with our study. We are actively in the study now. We started out in mid-April. A couple of points about the timeline and a couple of the activities that are happening during the timeline. I always like to work from top to bottom when discussing this slide. I think it's very important to note this is a multifaceted approach that we're taking with the study. So there is market analysis looking at our current market, but also benchmarking activities that are happening in other markets. That's part of why HRNA is so important and why they've engaged several consultants. But we're also looking at our local ecosystem, and it doesn't mean one particular lens. Obviously, that's why we're here in front of you all. We think that housing includes our homeless population, but also includes all of the needs that our city has in addressing that area. And then regulatory and policy analysis is sometimes forgotten when you have a study of this nature. It's always, how does the private sector do it? How do you get involved? How can you have philanthropic community come in? But we understand that there's a critical role that our city plays, that our other municipalities play in our region, as well as our city and our state and our federal government. And so we have kicked the project off. We do have a lot of our initial analysis underway, but our engagement, we feel, is the most critical part of the process. That engagement started in early May. It will be continuing throughout the process. This is a portion of that engagement. I would also like to highlight that towards the end of the presentation, I will show information where you all, as well as anyone who's here today or watching, has the opportunity to take a survey. We do have a dedicated email address for people to submit information. And we also will have draft recommendations that will be coming out in the coming weeks. And so we encourage people to send an email or sign up, and so you can get those updates sent directly to you. And then as those draft recommendations come out, there will be a public review process. So again, not only are we engaging here currently, gathering that feedback, developing our analysis, but we also plan to share that and then continue our engagement until we have what we're calling a final plan and an implementation plan as a part of that. The timeline for all that taking place is by the end of this calendar year. So the slide that's up there shows November. It'll very likely take all of that month. As you all can imagine, this is quite the task that we're taking on. Next slide. So one point that I would like to detail a little bit more, we talked about the importance of our stakeholder engagement. That has been taken on through several different paths. And so there is a technical committee that's been created. We do have practitioner roundtables where we've been engaging our nonprofit community, our service agencies. We have also engaged developers and operators of housing that supports all the income spectrums that we have in our city, but particularly those that are low income or those most in need. We are having community listen sessions. One thing that I think is really interesting is some of our stakeholder interviews, just an opportunity to have deep dive conversations to talk about some of the challenges that we've had. I think some of our roundtables have worked in that same fashion with the smaller, more intimate groups, really diving into the specific details at different income levels, with different challenges that people have in finding housing, whether that's returning from incarceration, whether that's having some type of mental or health disability. And so just, again, a broad brush, because we know it's something that affects a lot of our community in a lot of different ways. And then, again, critical and important is our Metro leadership, and you all are considered and included in that group. It's a critical part of our work. Again, we can come up with a great plan, but we understand it needs to be effectuated. And so we want to make sure that we're not only engaging you in the process, but also as we go into developing our recommendations, you all are taking part in that as well. So just briefly, our discussion today is meant to be interactive. It is meant to be towards the commission. I do know it's a public meeting. A lot of times when we've given this, it has been a closed room. If you hit the next slide. But we do have some ground rules that we like to just instill before every discussion. We, of course, want to be considerate of time. I think it's my responsibility to also do that now, respecting your commission and your agenda. But we do want everyone on the commission to participate. We know participation looks different for different folks, but by all means, if you feel like you want to write questions down and then ask them in successive order, if that's more what you prefer. And again, this is not a closed opportunity. We will be taking information and having conversations in the coming weeks and months. We'll ask that distractions are limited. And listen with an open mind. We think it's important to gather feedback and information from all perspectives and to respect all opinions. We do typically focus on honoring confidentiality. Again, this is a public meeting, so I understand that comes with the different context. However, at the end, like I said, if there are certain things that you want to share with us in confidence, we're happy to have those conversations with you. And then again, as I mentioned, the survey that's available, as well as emails that come directly to the team related to this study, will be kept in confidence. So there's still some opportunities for confidentiality as we go through the study. All right. Well, again, with the essence of time and making sure that we do have a very robust discussion, I would like to get us kicked off. You all should have these questions in front of you as well, but they are up on the screen for those who are watching and those who are listening to be able to see them as well. I will do my best to facilitate the conversation, but again, it's for me to talk probably as little as possible, and mostly to hear from you all and to obtain perspectives that our team would really love to possess when we leave this meeting. So we're kind of starting with the very big picture, again, painting with a broad brush to get us going, and we'd love to hear how you all would describe our current state of homelessness in the city, and particularly the priorities of the commission in addressing that current state.
I could go first. It's cricket quiet in here, y'all.
The first couple questions usually take a minute.
Let's get it kicked off, huh? So I feel like it has come a long way from where we were, if you will. I know a huge focus is encampments. As a person with lived experience, we know from the ground that a whole lot more happens. I'm not minimizing encampments. However, it's so much more beyond that happens. So being able to capture that and capture that data is huge. But I feel like we're en route to moving that way. Current state of homelessness, I feel like too, there is something happening behind the scenes with like evictions and a lot of them being illegal. And it comes from like uninhabitability and things of that nature. So being able to get to things in a preventative manner is huge, and something that I feel like we need to really be focusing on. I don't know if you want me to go bullet point by bullet point, but.
Feel free.
Okay, how does the HPC set priorities for addressing homelessness? I'm gonna look to some of my seasoned veterans around the table since I'm just sitting in this chair today. As far as setting priorities, I feel like, and if, like I said, if y'all want to input as well, but kind of going forth, I feel like this historical day and like this historical discussion happening, we've never seen it before, and with, I feel like, lived experience being in the equation where we've been making it towards that way along the way, and just being in this place, I feel like it's going to be so much more cohesive across the board, and being able to create a web, a stronger web of, especially like peer-to-peer support is huge, I think, and something that's been said around this table over the past year. And I think going to the next point, how does permanent supportive housing fit into your view of the HPC's priorities? I also think in that space, peer support would help with what's already there. So I'm the type of person, don't reinvent the wheel. What can we do with what we already have? So just strengthening that by adding in, I feel like that lived experience, and because we see something different that happens on the ground that might not be seen on different levels that are, you know, not in that community or space. So that's kind of my start off. Passing the mic to anyone else.
So when it comes to what my feeling for the current state of homelessness in Nashville, it's still very present. We still have, people flying signs off the on-ramps to the interstates. We still have people gathering down, congregating downtown. We have several encampments that are still up and running. That said, we have made a lot of progress in Nashville, especially when it comes to things like the permanent supportive housing with the Strobel House, and doing well by maintaining the interim housing sites and revising our outdoor encampment strategy. So, like, right now, I know a lot of talk is, again, on encampments. We've been focusing a lot on that. But homelessness is definitely, not just encampments. It's the people in the parking lots who are in their cars, people in RVs, people surfing on couches that just don't have a permanent place to call their own. Homelessness does... we want to think about, those who are already unhoused, literally on the street unhoused. We want to also think about those who are working several jobs and cannot get housing because their income is not enough and they're living on a friend's couch. They wouldn't necessarily themselves even call people to say they're homeless, but, without having a permanent domicile, these are people that we don't want to make sure fall through the cracks in this process. And so, when we're talking about housing, we want to make sure that we can bring everybody forward with that housing.
I can only address the first question. I just joined HPC last month, so I'm not going to talk about how we set priorities or anything. But I would say, compared to previously, homelessness right now in Nashville is very politicized. So there are a lot of people who are sharing their opinions, doing news stories. Things are becoming much less being able to be controlled by people who are providing the services. And there's a lot more voices in Nashville who are being very loud and controlling certain narratives that are being addressed in the community, making it harder in some ways for people to do work, personally.
Well, while others are thinking, I'll share this. I recently returned from a housing conference in San Diego, and you mentioned it being more politicized. I think they are dealing with that quite heavily. That was a big talking point. I think the other thing, and I think you mentioned this, is really trying to build a stronger fabric of supportive services. You know, there was a lot of conversation there about the housing first model. It's hard to have a foundation for any type of service without knowing where you're going to rest your head, and creating an ecosystem where people feel comfortable and can actually progress. The other thing that was a big topic there, and quite honestly, it was extremely hot for that population that's not used to that level of heat. But I remember just as I was planning to leave from here in Nashville to go there, it was really hot here, and so they had a lot of conversation about meeting people where they are in terms of, you know, dire need during extreme conditions. And I think that's something that's, as we talk about climate change, as we talk about the experience that we just recently had here in Nashville and other parts of our country, being able to talk about that as well. And so I'm curious if that's something that is kind of a focal point or in parts of the discussions that you all are having, whether inside this commission or outside of it. I think that's a very interesting piece in talking about permanent supportive housing, being able to have those locations where people can feel comfortable during those times of need, but also those more temporary and or timely solutions, I think is another thing that I won't give my opinion here, although I have a strong one, but I'm curious to hear from you all about that timeliness and the ability to respond when certain cases become drastic.
Well, I want to address some of those points, and I can get to that as well. I do think when you talk about the state of homelessness in Nashville, in agreement with my colleagues around this table, one thing that I do, and they know I love to make sure we are aware of it, that there is a huge inequity of homelessness and overrepresentation of people of color who are experiencing homelessness, and I think oftentimes their voices aren't heard. I think that training around how do we approach these, what does coordinated entry sites look like in places that are not comfortable for us, and how do we have an impact on that? And so when you think about what that state is, we know that there are definitely systematic things that have contributed to that, but also what are those things on the ground that are contributing to that? And how do we have a greater impact, and how do we get a focus on what that looks like, considering what the population overall is in terms of what that inequity is? We do have a gap in supportive services, as you stated. I think also when you talk about how has the HPC set priorities for addressing homelessness, we have looked at community strategic planning. And that community strategic plan has components of committees, which are within the continuum of care. And each of those committees can then look at how those priorities are set, and those committees can add to the goals that they think that that committee can achieve, and how can they address homelessness. So there has been technical assistance to aid us in that, also committees being added to address some of the concerns that people have expressed. So when you talk about a permanent housing, there's now a housing committee. So what would that look like long term, and how do we have more substantial funding? Because we do have $50 million, but that won't be longevity. I think that when we look at, again, permanent supportive housing and HPC priorities, one will need to be funding. And how are we educating the community? Yes, it's politicized. There is some divisiveness around how we are addressing homelessness, but how are we coming together to really educate the community on the depth of homelessness and the poverty and the trauma of it? And so if we were to do that, how could you get better buy-in to add to some of the organizations that are opposed to much of the work that we are doing? Then that could possibly give them an expansion of their resources, that could shift their board of directors' priorities around what this looks like. And then we could actually implement some of the housing first models, because it is expensive on agencies. And so how do we look at what that looks like? And I think coming together to do that would be great. I think we're aware of it. But I think there's a lot of a burden on the city. And how do we relieve just not, so it shouldn't be just the burden of the city, but how do we also look at how to support the nonprofit agencies that are on the ground doing the work, and how do we get them equipped in ways that align with their mission and the mission of this city? And I think that as we continue to look at that, and we are doing that, but there's definitely more to go. And so when you talk about the ecosystem and the current environment, absolutely, we need resources for that. And there are some resources that we have in this city to help in extreme weather conditions. They are oftentimes maybe not what some of our folks with lived expertise or that are currently experiencing homelessness would prefer. But I do know that, again, when you talk about when there are requests for funding proposals put out for agencies to take on these initiatives, and that they're put out for multiple years, multiple cycles, and we don't have agencies that are able to take on that ask, then to me, how are we looking at where the gap is? And so how can we do a better job of that? And that may be something that, as you all are gathering this data, can assist with, because I do think at some point we have to look at that. And how would that be versus just sort of commentary on what's needed?
I really appreciate that. I know, so I also served on our housing task force under our previous mayoral administration, and one of the big conversation points there was we as a city, our level of infrastructure and our level of non-government organizations that are built to kind of grow and scale with the needs of the city is really important. And how are we internalizing and addressing those? I think that's very important. I do have more specific questions after this one. So I think just because this one's general, I'd love to get people to weigh in from different perspectives, because there may be some that are more specific that may refine your points.
I was just going to add that I feel like right now homelessness in Nashville feels really dire. If we look at our HMIS data from last month, as a community, we housed 190 people, but at the same time, we entered 539 people into HMIS, and so we're doing a lot of good work, but yeah, it's just the inflow and outflow are not matching up. And when I think of what I would want to be in a unified housing strategy, like we've said, resources that include funding and a focus on services, support services for once we get people into housing, but also resources for prevention. There's so many people hanging on, by a thread. And so how can we get them funding and resources as quickly as possible with as little of paper burden as possible to make sure that they don't slip into homelessness and enter that cascade of things that are going to affect their lives. And then also overall, I think that we've created a system in Nashville where if you want or need resources or need assistance or need to find new or just housing in general, you have to have a caseworker. And so I'd like to see a system that creates more opportunities where folks can advocate for themselves, can find housing on their own. They don't have to rely on a caseworker, because some folks definitely do, need a little extra assistance and support navigating that, but there's a lot of folks that don't. But we've made a system where you have to have a caseworker to access a lot of the resources in Nashville.
That's great. That's great insight. Thank you for that.
I know where we're going to move on, but I just want to kind of follow up on what Jaha was saying, because it kind of sparked the idea. I was thinking about like the school and like the HERO program, us being better plugged into that as a city. The length of time people are in, that's something to evaluate. Access to service is ways for us to create our own income, especially like with ideas that come from the cab. That's something that all the members really have been talking about, of how they can sell their art or write a book or, whatever the case is, you can insert wherever. But that's huge, where I feel like we can work together and figure that part out as far as, funding goes, where it's not so burdensome or us not having access to it. And citywide collaboration, I would think like in the manner of us being able to access like council and especially from the board and or like with us working hand in hand with them and them knowing what's going on with the homeless realm or housing. So.
Absolutely, absolutely. I'm gonna ask to move to the next slide. You all have the slides in front of you, so again, if there's specific points you want to make about a certain question, by all means, raise that. To further the conversation, and I kind of led into this a little bit talking about the ecosystem, but again, that ecosystem is made up of a lot of different actors, a lot of different folks that come in and engage in different ways. And again, talking to the point that was mentioned about being preventative, not just addressing the current state that we may see. A lot of the comments and conversation lately has been about encampments, but really taking a deeper dive in how we can be a proactive city, proactive community. So I would love to hear, how are you seeing people that are working, and people, individuals, but also organizations working together, making some progress, what's working well and what could be improved? Where are those really strong observations that you all have where we should be focusing and trying to build kind of those stronger relationships?
Yeah, this is something I've been thinking about a lot, and I'll kind of speak to, I think, what is something we could look at through this unified housing plan is, I think we've brought more PSH units online, which is fantastic. Not every household exiting homelessness needs that level of support. And we have, from my understanding, more affordable housing with tax credits, with these Barnes funds, right, coming online. From my past experience in this work, from working in other communities, folks exiting homelessness have a really difficult time accessing LIHTC properties. So being able to form closer relationships between our homelessness response system and developers, so our nonprofit developers, which is I know what this plan is about, but also those private developers of, can we have a preferred waiting list with OHS, right, to work in tandem with coordinated entry? Can we have bonus points, right, in the allocation plan if you have an MOU with the service provider, so that we have those dedicated pipelines to housing that's going to be affordable for 30 plus years? And then we can save the resources of our landlord engagement team for folks that really have those additional barriers for the private landlords. And I feel like right now there's this kind of whole pool of housing in the middle that's not PSH, that's not privately owned, that I feel like we're not as well connected to as we possibly could be.
And I really appreciate those comments, especially, we say build relationships, but creating formal ways for those relationships to exist, and then also understanding some of the barriers, whether they're real and perceived, an education component around that, I think is really, really important. Other comments?
I think I need to add that it definitely feels like there is an opportunity to focus on what it's like to be a family and how we house families. Being new to the industry or to our cause, I don't hear a lot of conversation around how we support families, and their needs are unique. You can't just throw them into 300 square feet of a space, right? And you have to consider transportation and housing and education and childcare, all the different factors that go into housing a family, which are so different than housing an individual. And it just feels like there could be more opportunities to focus on them, because we know one of the best predictors of homelessness in the future is if you've experienced it as a child. So it seems like we will focus on that to make sure that we're not incurring or producing more homelessness in our future, and we can kind of tackle and cut that off now.
No, absolutely. Very sincerely appreciate that, and think more and more about it, the conversation about developing, creating, preserving housing for multi-generational households, right? Whether you think about children or seniors and caregivers, being able to really have the infrastructure and have just the home, right? The layout of a home and a facility that actually supports that.
So I land in this conversation somewhat different. My perspective moves away from a single word like housing to human flourishing. And what does human flourishing look like, and what are the elements for that reality? Education, economic development, healthcare, and housing. So those four pillars for us, as we are part of this thing called the church, we have distilled that we can no longer talk about the single issue. It's like a duck who's going to the other side of the pond. The duck looks cool, calm, and collected on the top. But what's going on the bottom is this duck is really overreacting and energized to get to the other side. Who are the partners? Who are the collective partners around these four pillars? Because we've seen some of this work in Charlotte, North Carolina, and it's working extremely well. Here in Nashville, we have a tendency to use these one words that I think are somewhat limited in our perspective. But for us, it's about human flourishing. I will agree with my brother. It's about families, it's about communities, it's about neighborhoods. Housing is a component, so we put a comma after housing as opposed to a period.
I appreciate that. Our engagement counterpart with NEPR, Kia Jarman, very, very similar, very, very much anecdotal approach of saying, hey, we have to think about people's livelihoods, how they're living, their quality of life outside of just the scene. It is, of course, a core component, but to your point, still a component. Other perspectives on that, and then also the second bullet point is very particular to the experience. And we talked a little bit about this and how there's different levels of approach to resources and being able to access those resources. But, from someone who is not involved in the process of facilitating and going through those, is there any opinions or feedback you've gotten from constituents or anyone that you're working with directly, whether that's representatives, about the experience of accessing and going through those portals? If there's if we're telling people the resources are there, that's one thing, but actually being able to access and navigate those resources sometimes is a different and more in-depth conversation that's needed. And so just wondering if there's any feedback that you all have had, or just specifically areas we should look and go and gather feedback for ourselves.
So I won't say it as nearly as eloquent as Pastor Handy, but in looking at Strobel House, medical respite is desperately needed. We have a population that's probably, the average mortality age was 52 last year. The year before that was 54. Living on the streets, they may look and appear and have the medical concerns of someone that's much older than their actual age. And knowing people that's been living on the streets, and they go to Strobel House, and the day one, they end up in medical respite. Day two, they're in a live hospice. They're barely hanging on outside. And so thinking of the whole family, the whole individual flourishing, medical concerns need to be addressed at a much earlier rate, and housing opportunities that come along with all of the supportive services that's needed in order to help address. There's a lot that, based on their age or based on some of their disabilities, people may qualify for Medicaid, Medicare, not just based on their age, but based on their disabling conditions. And I feel as though, as a community, that's not sometimes the focus when you know that someone's been at the same spot, same place for the last 5 years. Our average, I haven't looked at it recently, but our average time for people experiencing homelessness in Nashville was 5 years. And we're experiencing people, when we're looking at length of stay, to help people that's been outside much longer to move into Strobel, we're hitting numbers at 10, 12, 15 years, which is unfortunate.
Your question was about how easy it is for our folks to access services. I think, as India mentioned, it's pretty difficult if there's not a case manager. I work for run a really small nonprofit. It's me and one other person, so we don't have capacity to case manage. So there are a lot of times where I have to be like, hey, you can get into this, but you have to find a case manager to get it for you, because I've been on calls where the reason people are getting housed is because somebody can speak up and say, hey, I'm working with them, I can find them, I can get them into this place. And that's way easier than somebody being like, yeah, we know this guy needs it, but no one's seen him for 2 weeks because he doesn't have a case manager. So I think that's really difficult, that we, like India had mentioned, have kind of siloed off some of our programs to not being accessible for somebody to advocate for themselves. And we have people that are perfectly capable of being able to advocate for themselves. So I would love to see that being brought in, so that way our folks can have that autonomy to be able to help with their own housing decisions.
The one I want to say is access. Again, I'm probably going to be saying that word the whole time, but access to the vouchers, or even in the case of, because I speak from a perspective of the lived experience, being someone that receives services and also from a provider standpoint. So I'm kind of an odd case. However, it's very hard to reach out to the different entities and get straight answers or find what this means. For example, if I have a voucher, people don't know that it's so much attached to the back of your vouchers and or what even type of voucher you have, or a lot of people come to us and say, we don't know what this is. It's a public education thing. And again, it comes into the people that can do that and advocate with those people, our peers. So it's like getting the peer-to-peer, and even to what you were saying, getting peers to be able to help each other, because even down to the point where people can move in somewhere and not know how to work something that is inside the house, or they're used to being outside, so they leave their door open. It could be a security issue, but they're used to being outside. And or when they're in encampments, they get separated from community. When they have to leave each other, it's just so many different dynamics that are unknown variables, basically. So,
So there's been a lot of people that have said a lot of really good things. Director Calvin started talking about healthcare, and I think this is sort of out of the priority of what I was going to talk about, but I think it's important to talk about it first, since she said that, is that I think we really need to start discussing and advocating for, with our state legislature, for Medicaid expansion. We are one of 10 states left that has not done that. And that is highly politicized, and it's unfortunate. We're leaving a lot of money on the table, quite frankly. And that is something that could be meaningful, especially in this population. I'm personally frustrated. I think the first question was, what is the state of homelessness? My state of, looking at it is just straight up frustration. India mentioned, we housed, 190, but we also entered in 500 plus people. So we're going in the wrong direction. When you look at this snapshot that is really fantastic information, and I appreciate you doing this every single month, we're going in the wrong direction. When you look at September of last year, those numbers, September of this year, we are higher in every single category. And so we, in 2022, put $50 million of ARPA dollars into this. Is it a money issue? I don't know. I think we do a lot of talking in here. I've been on this council with their board for a year now. We talk a lot. I don't see a whole lot actually happening. Where's the action coming from? And so I'm frustrated on every single level. We talk about meeting people where they are. There are so many different types of homelessness and people experiencing different things that we are not meeting them where they are, because we look at it in one big category. Oh, homelessness. And that is not the way to look at it at all. Everybody has a different need. We are not meeting those needs. We talk a lot. The people that I have worked with are chronically homeless. They are in those homeless encampments. They have obviously much more significant need from a wraparound services perspective. At the end of the day, it sort of all comes down to money, because we have to pay for those services. We have to pay for that housing. We have to pay for everything. Where is that money coming from? But at the same time, when you look at the $25 million that we put into this a little over a year ago, and yet we're going in the wrong direction, even after $25 million. So are we spending that money wisely? Is it just not enough? What are we doing wrong? Because we're doing something wrong. One of the things that I was concerned about when we were writing this massive check from Metro for the $50 million was, I've given this analogy multiple times. It's a bathtub, and at any point in time, you know how much water or how many people are in this bathtub, and you can scoop out the water in the bathtub. But if you don't turn the faucet off, that is an exercise in futility and insanity. So we're not doing preventative in a meaningful way. I know we're trying to, and we talk about it, but it's not actually happening clearly. So what I'm hoping for this next year, and I accepted the position on executive committee, I'm tired of talking about it. We clearly have to continue to talk about it, and we talk about coordination, and we talk about collaboration, but let's actually do it. And we've got a lot of really great organizations that work in this space. We've got a lot of people that are dedicated, like Director Calvin, that are in Metro leaders that are dedicated, and fantastic people, again, departments, things like that. And it's not, to your point, it is not just housing. It's not one thing, it's multifaceted. And so I think we need to look at the population and separate that out. And where can you have smaller buckets where you understand how to address that? How many people do I say, oh, there's a hot spot popping up at XYZ location? Are they in HMIS? Yep, they're in HMIS. How long have they been waiting for whatever? Years? You know, they just sit there and they wait and they wait and they wait because we don't have any place to put them. We don't have the services to address their needs. Where's that money coming from? I don't know. So it's this big bad circle. But I feel like what we do every single month at this board is look at, well, what's happening this month? We're looking backwards. We're just going like, okay, but we're not looking at what can we do in a meaningful way to have an actual plan that we can execute to make a difference.
Thanks for that input.
I think Councilperson Johnson brings up another good point about the data. It feels like there may be an opportunity to find ways to identify who is experiencing homelessness, particularly families. Many of them are on the streets, they're in parking lots, they're hidden because of fear of losing their kids, being separated, potentially maybe not even going to jail. So they hide and it's hard to find them. And it's hard to know whether they are new people experiencing homelessness or that we've kind of gotten better at counting them. So until we get solid about how we are counting them, it's kind of hard to know which way the actual needle is moving, because if you're better at counting them, 1 year could seem like a big jump, but maybe you just know more now. And then you can start tackling what you know now. So I think we're just still like on that curve, the learning curve, right? Or how do we identify families, people who are hiding? Because many of them are simply an argument away from experiencing literal homelessness.
Absolutely.
And that's just the reality of their homelessness.
One more thing I would like to add is just within the last year and a half, look at my HMIS team's face, right? Just within the last year and a half has been when more people have been entered into the system. Prior to COVID, people living outside were not really entered into HMIS. And so we're going to continue to see our numbers grow simply because we've never really hit a baseline. If they've been outside 5 to 10 years, it doesn't mean that they're first-time homeless. So really trying to figure out, I charge my team with figuring out what's first-time homeless, what's been outside for a long time or unsheltered for a very long time, and we really need to grab hold of that. Also, we're going to continue to see our numbers go up and down because we're, 1 month shy, I'll say, 1 month shy of having the missions data entered into this database. So all of these numbers are really going to be juggled because for over 15 years or since we've had HMIS, the missions data has not been fully incorporated in our database. So for me, trying to find a baseline, what's the foundation so that we can build from there. We know what we need. We don't know how much of it we need because we don't know how many people based on the data. So this is probably the best that our data has ever been as a city. I'm proud of all of the service providers and outreach workers that has helped to make that happen, and our HMIS team for cleaning it up and scrubbing it monthly. So I think that comes with a little bit of patience that none of us have, right?
Absolutely. And I'll say this, just from the perspective of the housing task force as a whole, not having a specific focus on homelessness, but having that broad view, one of our main points was our data was poor. I mean, it was not usable in essence, right? And so being able to put a huge amount of effort into that, and speaking from the planning commissioner standpoint, but from our planning staff and the housing division, that's just been a task. And it's a huge task, but it's putting us in a better position. And so just, again, those efforts need to happen. You're only as good as the data you have and information you have, and honestly, it creates the opportunity to make a better case going forward. So that's noted, and it's continuing to be a common thread through our different roundtables. Absolutely. I'm going to ask, but again, I'm not cutting anyone's ability to speak off. I'm going to advance the slide just so you can see the next set of questions. I think very timely because we heard some conversations about ARPA funds. We also had early comments about just funding in general. But curious, as we talk about the funds that came post-COVID, and then actually, the efforts that we put forward, utilizing those funds. What do you think of that? I mean, we heard some comments about it, and I think there's some improvements that obviously can be made on any steps you take, and looking back in the past. But are there specific takeaways from that funding? Was it not enough? Was it not acutely enough focused on different groups and in different ways?
I think it would be really great, and I've said this already, to see some of that funding going to people who are actually carrying caseloads. So we have people who are putting data in, but again, the data is great, but if you can't find the people to actually get them housed, you're not able to translate the data into housing. So I would love to see money being used for people who actually carry a caseload, who are actually able to help navigate these people through the process and get them housed. Right now, people are getting put in HMIS, and in their minds, even though they're not necessarily being told this, they believe that means they have a case manager. I sat down with you for an hour and a half. I told you my life story. It was put into this data. You're going to now come find me when I have a housing opportunity. And that's not necessarily how it's working. So to be able to have somebody okay, I put you in CE. I'm now going to check on you. I'm going to help you get all these things in a very this is my caseload versus oh, I'm someone with OHS and can help you, or I'm someone from this agency and can help you, or I'm someone. So having someone who's actually you're on my caseload until you're housed, and be able to really move those people through the process, because I've been doing this for 10 years now, and there's part of the processes I still don't understand. And I'm on tons of committees. I mean, yes, I don't do case management, so there's that, but it's just, I think that there could really be actively moving the needle if we have case managers taking on caseloads and having that funding used for that piece.
And I think, again, the effectuation, right? The action, the moving to the next step, right? Having that plan of what the next step looks like and being able to clearly communicate and educate people when you have them in front of you of what that looks like is important. Other comments from previous questions or this question in particular?
There are so many questions and comments about so much. With lived experience, touch and base, I'll get so emotional. These people are numbers. They're people, aren't numbers, they're people. So as we're sitting here and we're making a plan to make a plan to make a plan, there's people added to that moment of silence. As we are sitting here right now, how many people are out there taking their last breath or overdosing? We aren't using the resources that prevent, the caseworkers and everything. I thought I had a caseworker, just like she was saying. And so there's a lack of communication between the friend out there and then the caseworker and the organizations. And if we all could come together instead of, well, I got this person. No, okay, well, what worked for you? How did this help? Because I'm having a hard time getting this person housed. They're struggling with this. Every person is different, personalized, peer support, and throughout. I needed help getting housing, navigating what it's like to live there, and then also everyday things, there's a bus. Okay, how do I get the bus transportation? How do I get on there? Okay, wait, mental health, where do I start? Things that are every day to us. Well, not really me right now, working on it, we don't think about, it's just this person needs this person needs this, but there's no communication with the other organizations, and there's definitely no communication with the client themselves. So sitting there telling your story and needing help and then trusting, and then it's just, we're locked into a number. And I just think that the listening and the funding, and it needs to go hand in hand. And not planning and planning, doing and doing. But that's where the money comes in, because, I mean, we have people that have the heart in it, but, you know, you have to survive too, and you can put your heart in it all your time, but the reality is the peer support needs to be put into action. And, you know, housing first so we can find out who has the medical needs. I had no clue what mine were. And when you have no clue in your survival, and you're in survival mode, you know, not only are you having a hard transition, but you're slowly dying because of the effects of being out there and being homeless and not being able to ask for help because you can't find your caseworker. It gives you no hope. So it's all about the people. It's not about numbers. It's not about anything. It's about the people and what that person needs. And the fact that I am taking the time to see you. I am going to find you. But we don't have the funding to give the support of the supportive housing.
Thank you for sharing that. I see one or two more hands. I'm going to ask to go to the last. So the last slide is kind of an all-encompassing question, but I think it's one that's very important. And that's how does my role, my responsibility, our teams collectively, how does this study, and again, it's a study, right? But how do we program things into that? Because part of that delivery is an implementation plan. I think a lot of what's starting to culminate here as we've gone through these questions is kind of what's that next step? What are you doing with this information? Whether it's data that's being gathered independently, whether it's data that's being gathered in this study, how does that turn into something that will actually be implemented? How do you start to move the needle in the direction you want to see it go? Because again, as articulated by our council member, if you're not turning off the faucet, you're continuously putting forward that effort, but you're not actually mitigating the causes. And so we'd love to hear from, and if you haven't spoke, we'd absolutely love to hear from you now, and just how can this study help? And that's not meant to be prescriptive. Don't refine that. It's for us to take it in and figure out how we utilize it. But we'd love to hear how this effort is something that could benefit the causes and the mission of this commission.
I think it would be helpful, and maybe it's already been done, I don't know, to look at the different ways people are becoming homeless, right? Are you coming out of jail? That's one group. Are you being evicted? That's one group. Are you a victim of domestic violence? That's one group. Like what all those things are and how do you address that specific group? So you have a prescriptive way of handling all those needs, and you have an action plan, and you have either service providers that are honing in on that particular group of people so that they know they have a caseworker or they can navigate however they need to, but that there's a plan when we say, you know, John Smith, new into HMIS, where are you coming from, whatever. Also, how can we prevent those? You know, I know we have someone is here from the prison, or they usually are. Yeah. Where we say, okay, you know, you're going to be let out in a month or whatever it is, and let's figure out where you're going to go so they don't just open up the doors and go, okay, good luck. I mean, that's a serious problem. Having that, you know, homelessness is such a big thing, and I think it gets overwhelming, and I think that's why we talk in circles a lot, because we're not taking it into bite-size categories where it is more manageable just mentally, really. Because we come out of here, and I don't know that anybody, I mean, I don't walk out with a sense of clarity. Does anybody walk out of these meetings with a sense of clarity? I don't. Because it is so overwhelming and there's lots of different things. So then it's like, where are you going to go? So we have to figure out where they're going to go. Who's going to provide those supportive, you know, services? But have it organized so that you know who does what, so that you really truly are working in a collaborative, cooperative way, and everybody knows what they're supposed to do. Right now, I think everybody's trying to do their best, and they go out and they're working every day tirelessly, but there's probably a lot of duplicative effort. There's probably a lot of people that get mixed or lost in the system, as she's saying, because we don't really have a coordinated, we call it coordinated entry, but I don't think there's anything coordinated about it. And so how can we fix that? Like, let's get it organized and figure out where people are coming from, where they are now, what they need, where they need to go, and how we're gonna get the funding to do it. I think we're making it way more complicated. It is complicated, but we make it more complicated by all this nonsense. So that's what I want to come up with, is what is the action plan? And how are we going to move the needle in the right direction every single month, instead of just saying, okay, well, here's the new numbers this month, and let's have an emotional story and da-da-da-da-da. No. We got to fix this problem in a meaningful way.
And I think, to roll off of that, I agree, and thank you for saying that. I think something else that would feel supportive from this study or this plan, kind of whatever, is as we, as a community, need to map out and better understand the homelessness response system and why folks are experiencing homelessness and the prevention side of it. I think also you mentioned, right, like our housing data on the housing planning department wasn't in a great space. So something that I would love to see is from that side, right, of can we actually have an accurate map of what is the affordable housing like in our city? What's expiring, right? Are there LIHTC programs that are gonna roll off and then folks are gonna suddenly, their rents are gonna spike? Can we get ahead of that so that we can start doing some prevention? What developments are coming online? Like, are we actually talking to each other as a system? And I feel like I'm not super aware of really clear data at this point that shows us what our affordable housing system looks like. So something that I would love to see from these efforts is a really clear, like, actor and resource map of our affordable housing system.
I'll say real quickly, because I know that we're trying to be respectful of time. I think that looking at the group of people who are exiting housing that they received as a housing first or Section 8 voucher, I think there needs to be a really directed effort about why they weren't able to sustain housing. I think that there's a lack of supportive services after people are housed. It can be just as traumatic on people to be moved back into housing as it was when they first experienced homelessness. And I think a lot of people have a really significant struggle, and it would be very helpful to see why people aren't being successful and then meet those needs.
I just wanted to say that I think it will be really helpful for this unified housing strategy to really make a commitment to focusing on housing efforts and supporting housing efforts for our folks that are earning at that 30% or 30% AMI or below. I think that there's this economic idea that, yes, we need more housing units at all income levels. Like, we know we had your Mayor's Affordable Housing Task Force that you were a part of, that report, come out and say that. And there's this idea, if we continue to build housing at all of these levels, eventually the market will soften and rent prices will go down. But ultimately, I feel like our people, as soft as the market gets, our people at the bottom are not going to feel that in a tangible, meaningful way. Because their income's so low and because they have such significant barriers. So any additional help to try to, break that inequity is just something that I would urge. Like, we need, the planning department's help and focus on bringing on more units online and supporting the creation and preservation of those really deeply affordable units.
Understood. Okay. Looking to the chair, I know we have already probably extended our time.
Yes.
Again, thank you all for the privilege of coming before you.
Thank you.
If you would advance the last slide, just so that it's shared with the public, I think it's really important. So the next steps, again, there's a website you can go directly to where you can sign up and check for updates. Again, we really encourage anyone who's seeing this and to share this with anyone who may not have seen this to take the survey. It's open until later in September. We'll be gathering all the information. The survey, again, is confidential. And if there's any other questions or further points that you would like to make, please email them to unifiedhousingstrategy@nashville.gov. Again, this is not meant to be a confined conversation, but we appreciate the time this morning to come before you. Again, a pleasure, and thank you all for what you're doing. I know the challenge is immense, and sometimes it is quite frustrating to try to tackle it, but glad to be a part of helping that. Thank you all.
Thank you so very much, and I do apologize for the time going over. It's a very important discussion, and I'm so glad that everybody was able to weigh in. I'm gonna go straight into our updates and allow Office of Homeless Services and basically that team to update for us. I'm gonna go ahead and say on new business, we're gonna have a doodle poll sent out so we can choose the date for the Homeless Planning Council Board orientation. That will be good for everybody across the board. Other business, and I do acknowledge that I saw someone's hand back in the back, but if we could save that till the cab part, I just wanted to acknowledge I saw you. But if we could go into Director Calvin's Homeless Services report, please.
I won't go long. Everyone should have a report on their desk in their package. So just a couple of things to highlight is you will get the doodle poll for the fall new members orientation and the spring board retreat. You'll get a doodle poll for that. I think there's a lot of confusion out there about what's going on in Old Tent City encampment. Just want to speak on that just a little bit so it's on record. There was 6 people that had built some really elaborate structures there. One that had kind of climbed up to the pole and connected to the NES main power line. And NES went out twice to disconnect, and they continued to reconnect. And so between multiple departments, MNPD, codes, NES, TDOT, NDOT, OHS, it was decided that those 6 structures would need to be removed. Some of them are 2- and 3-story. They kind of sway when the wind blows, so there's a huge concern there. Our team has been out there, so I just want to make sure everyone knows. Old Tent City is not being aligned for a camp closure. The 6 structures will be removed, and the path that was under the Solomon Evans Bridge, which was state property, they have pulled back, and they're not going to do construction at this point, but they are hugely concerned about the integrity of the bridge there. And absolutely. So OHS is out there every day. If you're a part of an outreach team, you should have received an email that shows the dates and times that our OHS team will be there. We're looking to get some tents. India and Open Table has connected, saying that they can provide some tents and other supplies for those 6 individuals. So I just wanted to make sure. I know there's some news stories that hit while I was away in Atlanta. I just got back from Built for Zero conference where they're talking about encampments and encampment strategies and how you don't have to have a knee-jerk reaction to a situation like this if you actually have a strategy that you're following. And so more to come from that one. We don't have really enough time, so I won't talk about it. Also, I talked a little bit about the 190. Hannah was so excited about that 190 because we hadn't hit a number like that since almost a year ago, maybe 8 months ago. And so being able to have more housing opportunities for people, but the prevention and diversion efforts of closing the front door is vitally important. We are working with Nicole Pispin. Say it louder. Pispinen. Nicole from the United Way. They received some funds for prevention and diversion, like capacity building. There is a whole fan committee, and this is one of the things I wanted to speak of. There's a whole fan committee with multiple agencies that participate in prevention and diversion, but their system does not speak to HMIS system. And we've not found a real great way of how to blend the two outside of attending those meetings. And I think that United Way is building that capacity. That's definitely something that's within their wheelhouse, and we're excited about that. So anyways, let's see, there was one more thing I wanted to mention. There is a lot of funding opportunities that are going on right now. The grants team, Bill and Allison and Raquel, are working night and day. There was a youth demonstration grant that went in with Susie Tomey's assistance, helping to hit the magic button. Also, HUD has released the Builds Grant, which is funding for people that want to build PSH. We're excited about that because I think it's the first of its kind, and we will hit the submit button. There is a RFP that is, you should have received it through Constant Contact, and so we'll do a local award, a local competition here because in reading the NOFO, there's only one project that can be submitted, multiple locations, but one project. So we want to make sure that we submit a very competitive application to make sure we receive those funds in Nashville. And then the COC funds. Next month, I know we held you all really long today. Don't make us pay for it because next month we need everyone here because we will be voting on the rank and review from the PEC committee. There's more here.
We do have a question from the report.
Yes, so Director Calvin, I did want to just follow up about the encampments. About 4 weeks ago, the Berry Hill Police Department, it closed an encampment off of Thompson Lane. And I wanted to know, since Berry Hill is part of Davidson County as a whole, but is not necessarily under the metropolitan government, what kind of steps are we taking to partner with our neighboring municipalities?
Well, I'll check into that, but I've not received any information of a camp that was closed by Berry Hill, but I'm making note and we'll check in with our outreach team on that. I mean, the state and the state troopers are really working closely with us. I'm pretty sure that, I'm not sure of the precinct that's in.
I was just going to say that's my council district, and I haven't heard of it either. So when you get that information of where that was, please let me know, and I can help follow up as well.
I can send you, there's a news article or a couple news stories about it also, where they interviewed the police and some of the residents as well.
Berry Hill?
Yeah, that's actually how I learned about this encampment closure.
Thank you all for that. If we can go to Allison Cantway, please, for our collaborative applicant report update.
Okay, I will speak so fast. As April said, well, obviously it's NOFO season. This is our first year as the collaborative applicant. Now, as everybody knows, while OHS has been voted to be the collaborative applicant and we're really acting in that capacity, we're still waiting on the paperwork from HUD to process. Though we did get an email from the HUD field office last week that I think is indicative that those gears are turning. So that's great. In our first year of being the collaborative applicant, we got 3 NOFOs, which was very unexpected. We only expected the one. But we did submit the YHDP application a few weeks ago. We had a lot of support from the community in writing that application, and so we're really grateful for that. And then, as April said, grateful for Susie because MDHA still has to submit. We just released today the COC Builds application, and so y'all should have access to that. As April said, we'll do a local competition because we're only allowed to submit one. And then the sort of the big COC NOFO process is ongoing. The PEC is meeting next week they have already rated all of the renewal projects. Next week they're gonna meet to rate all of the new and the DB bonus. Does anybody have any questions?
Thank you, Allison. Homeless Management Information System report from Hannah.
It sounds like everyone already read my report, so I think we're great. Like some people noticed, so 3,223 people experienced homelessness in Nashville in August 2024. That is a slow increase over the past few months and an increase if we look at September 2023. That was 2,090 adult-only households and 321 families. Additionally, 46% of those people were experiencing chronic homelessness at 1,489. Just to be quick, the highlights on the back, like we said, 190 people moved into permanent housing, which is the highest that it has been in a month since November of 2023, so that is progress. And 78 of those people were experiencing chronic homelessness. And I would also like to highlight 22 of those households moved into permanent supportive housing, which is certainly the highest it's ever been since I've done this report. So thank you to the Strobel Center for opening for a lot of those households moving in.
Thank you so much, Hannah. Thank you guys for being speakers here. We needed to have that discussion we had, so thank you guys so very much for adjusting. And if we could have Miss Raquel, and she's going to do the Continuum of Care update as our manager for the Continuum of Care.
I'm also going to try to be as quick as possible and just pull out some highlights. You do have this report in front of you, which provides an overview from each committee, when they're meeting next, who their chair is, and things that they've worked on in the recent past. One thing to note is that we've been doing a lot of updates to the website, so I would highly encourage y'all to go and check. So I added some links to this document. So we've created a separate Homelessness Planning Council website that links to a Continuum of Care website, which links to a Continuum of Care committee's website, and then there's a lot of resources from each committee. And so as committees are working on documents or getting things approved through the Homelessness Planning Council, we're hoping to continue to update that there so that information is more accessible. A couple of things to note. So as Allison mentioned, the Performance Evaluation Committee is meeting next week to do the rating and ranking of new applications. The Housing Opportunities Committee still needs to launch, but that's hopefully going to happen soon. The Data and HMIS Oversight Committee has determined some proposed revisions to the HMIS Policies and Procedures Manual. That is out for public comment currently, and so I encourage any council members as well as the public to take a look at that manual so that we can have as much feedback as possible before it comes in front of this council. The Point in Time Count Subcommittee relaunched, so we are gearing up for January 2025 for the next Point in Time Count. So if you or anyone you know is interested in volunteering, we're hoping to get that volunteer form out to the community soon. Let's see. The Coordinated Entry Oversight Committee also launched, and so they've had 2 meetings in the last month or so. They're hoping to meet on the first Wednesday of each month, and we had a lot of folks with lived experience come to the last meeting, which I think was helpful in grounding us in the process. So they're in the process of figuring out a 1-year timeline to work on multiple initiatives that have been set forth both in the strategic plan as well as in their committee description. The Standards of Care Committee is also intended to launch. And then Equity and Diversity Committee, one thing to note is that they have worked on an Equity and Diversity Resources page. That's online. They might make a couple tweaks here and there, and so they're hoping to then push it out to the community so that the community is aware of a lot of good resources that they've researched and identified that hopefully will help both organizations and individuals trying to improve equity, especially racial equity in our community. And then a couple things to note about lived experience. I know Kenitha has a section to talk about it, but I just want to celebrate that in the last 6 months or so, we have had 130 people with lived experience engage with the Youth Action Board, the Consumer Advisory Board, and across the continuum of care. And so that's really something to celebrate. The Youth Action Board launched at the beginning of July, and they've really hit the ground running. They created a great video for our Youth Homelessness Demonstration Program grant application, and are excited to work on new initiatives. They had the HERO program out at their last meeting to talk about school initiatives. And the Consumer Advisory Board had a great listening session on the Unified Housing Strategy as well to make sure that those lived experience voices were heard. So those are the updates that we have at this time.
Thank you so very much, Raquel. I am gonna go ahead and go into the story of progress. For myself, as far as the story of progress, like Raquel said, we've had a huge increase of members, and some of our members are sitting in the audience. Thank you so very much. I see you all out in the community at every single meeting, so I'm so glad of your involvement. And some people come and tell me they got keys, and I'm so very excited for them. So with my slide, I'm gonna let you refer to the paperwork. I do wanna allow my Consumer Advisory Board members time to speak, and I know I had one in the back that wanted to say something. His hand was up when we were having the discussion. And also our Policy and Advocacy Chair, Miss April Burns Norris. I know she had something prepared. So I'm gonna give my time to them. I do wanna show you guys this stack right here. This right here is all my newspapers I get each time I go to the contributors. Somebody hands me their article, or this is the movie from Fort Negley's closing. One of our cab members was the captain of the site, and the co-captain is also a member. So I thought that was very cool that they have a movie. I watched it on YouTube. I was yelling at the TV, so it's very good to watch. I want to have a screening one day for it, but and also how to become a vendor. I saw a story about that where they're trying to block them from like the Gulch and, downtown. But again, humanity, we want to lift up people and let them try to get out of the situation they're in and honor that they're trying. As I said, if I could have our policy and advocacy chair come up and give what she was going to present. But if you all want to go through, I know I have the slides and I really want to go through them, but it has our Consumer Advisory Board Sustainability Assessment results, which is scored pretty high. It's not too many that are scored very low, but you have this in your packet if you could go through it. And we have, while Ms. April is coming up, I know it's a statement in there that one of the CAB members made. And he was telling his vision and dream of the path to dignity and reintegration into homelessness. That's something we just talked about. If that could sit there while Miss April's talking and y'all can go over that again, it's in your packet. But I just love, as the chair of the Consumer Advisory Board as well, just the humans. I love the humans. They are so very super intelligent and they have so much to offer. I really think they're hidden jewels. So what people have to bring forth in their voice is so important. And I look forward to us continuing to grow and also collaborate. I would be remiss, as Miss April says, if I did not mention Mr. Albert Townsend. Huge, very huge shout out to him. National Alliance to End Homelessness. That is, I might just steal him as my personal mentor at this point. But just been phenomenal. And he is also the director of lived experience for the National Alliance to End Homelessness. But very down to earth, very so much teaching us his jewels that he has gone throughout his years of this work. So we're all looking forward to grow. I'll turn it over to April, and I think after that we would be dismissed. Thank you.
All right, thank you so much, Kenita, for giving me this opportunity to speak on behalf of the CAB. Can y'all hear me? This is my first time standing up here. I just want to say that it's been a rocky road getting to this point, but we are here with the CAB, and I'm so grateful that we are finally starting to equitably include the voices of people with lived experience of homelessness. And although we've been fighting for it as advocates, we wouldn't be here if it wasn't for the people around you all. Jaha, I will, give you a big shout out because you were that voice that really let it be known that we needed to be heard. And without hearing what the people that are affected by homelessness are needing, how can you all effectively do your work? And so now that we are here with the CAB, I think that we are making a lot of progress. For one, the Strobel House, being able to hear what people are saying as far as not having housing and to see the encampments and everything going on with that, and to finally see those people getting housing, it's just really near and dear to me because as a person who has been homeless and sleeping in my vehicle, and now as an employee of the Strobel House, when I see those units, it really makes me, it brings tears to my eyes because that was what was needed. And I'm so grateful to be a part of that, and I want to thank y'all. So I really say that we've done a lot of work collectively. We might not have always agreed, but we learned to put our disagreements aside so that we can continue to do this work. And I really say that thank you, April, for doing everything that you've done because it's just amazing to see it. I mean, you do. So I can't even speak on April. April is just, leave that alone. But it's huge. And she's even gone as far as getting Albert involved because his knowledge and leadership as a person with lived experience has been great for us because we didn't really know what we were doing. We just knew that we wanted it. We didn't really know how to put those pieces in place. And so to have that leadership and guidance is everything for us. And we're just excited about where we're going in the future. I will say that what we want to do is include some of the residents at the Strobel House to come and be part of the CAB. We have a lot of people that are interested And so I've talked to the director there, and she's open to bringing some of those people in. And I just see opportunity for growth, and I'm just happy to be a part of it. So that's all I have to say.
Thank you so much, Miss April. Mr. Robert, did you want to speak and say something? He's one of our CAB members as well. And he has joined a few boards, and he thought he was not eligible to do so. And we were like, what? Come on. So, welcome, Mr. Robert.
Thank you, Ms. Councilwoman. To iterate on some of the issues that was brought up with the previous gentleman. All right, I've been incarcerated most of my life. They didn't tell me, okay, you need to go here, you need to go there. This is your rules you got to follow. So they just open your door, kick you out on the street. They don't care. And I came over here in 2007. I was homeless up until a little over 3 years ago. But thanks to my boss, now I'm back living in my car. But anyway, there's so many of Nashvillians are trying to get rid of the homeless completely. They do not want them in downtown Nashville at all. I see them down there, they're digging in the trash can, trying to find something to eat, whatever. Now, true is what the councilwoman said. It's talk. I know there's, 8,000 something homeless in Nashville, if not more now. True, there's not enough caseworkers. Mental health co-op, 30 minutes. That's not enough to figure out what is the problem. They give them a pill, okay, this is going to fix your problem. No. I've been there, I've done that, and I stopped. I know how to survive without the mental health. Yes, do I still get stupid-headed? Yeah, and I'm always going to do that. But as far as the city council goes, there are abandoned buildings that could be looked at. For instance, Park Center down on First. It could be remodeled to house cold weather, protection. There's options that could be looked at, but it's nobody's looking. Only thing they're looking is how much money can they build these high rises. That's all. It has to be. I know some agencies may not be connecting with other agencies, but as a group, we got to come together to figure out what is the big problem. Quit looking at the little bitty problems. It ain't so much as the 50 million that the government has. It's as individuals, we have to figure out what is the problems. There's homeless that's tried the case management, different resources, and the only thing they get is a door slammed in their face. That's got to stop. Because if it doesn't stop, the homeless is going to keep going up and up and up. And the vouchers, they only cover so much. Okay, what is it, 3 years max? If you put these people in housing, Wallace Road, for instance, the rent there is $1,400 a month. All right, once that voucher is over, guess what? They're back on the street. So there has to be some type of affordable housing to where people can afford. Like I draw Social Security, $943 a month. All right, they're talking about Wallace Road apartments or studios. Once that voucher's up, can I afford that? No. So I'm gonna be right back where I started. So there's a lot of issues that has to be resolved, but we got to do it as a community. I just recently come up with ideas on. I know how the mission is on clothing donations. Mm-hmm. No, I don't agree. So I've took it upon myself, and the help of Brittany Morris, is collecting clothes for all ages, from toddlers on up. and just have to find a place to put them. Right now, my storage. But, I'm not just looking at the overall picture. I'm trying to figure out what to do with the youth, get them more involved in the YAB, and all the different avenues. It's truth, families are very important.
Mm-hmm.
I see these children out on the street, and it's sad.
Yep.
We just got to come together as a whole. Thank you.
Thank you so very much, Mr. Robert. I appreciate you both. And the person he mentioned, Miss Brittany, she's always almost at every meeting, and that is the daughter of Mr. Taz, which, again, when I showed you this video, remember, he was the co-captain of this. It was one person on side A and another person on side B. They were very organized. And so she's the daughter of Mr. Taz. So I just love, and I was telling Michelle earlier that I'm bad with learning names, but my cab members, I know them. I told them also, like, that's the first time that I'm like, I know who that is, and those are my people. So much love to the cab. It is very much so a story of progress. If there are no more comments or questions or concern, I will move to the close of the meeting. Announcements are located on your agenda on where other meetings will be. I do want to send a huge shout out to the Youth Action Board and its new chairs as well. I forgot them in the beginning, but wanted to make sure to encompass them. But everyone have a phenomenal week. Thank you so very much for a phenomenal meeting. This was very much so awesome. So you all have a awesome week. Thank you. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.